Welcome to Health Bulletin. Today, we'll discuss the forecast that future zoonotic disease pandemics could become much deadlier, potentially 12 times more deadly by 2050 due to climate change. We'll also explore how recent epidemics like COVID-19 have highlighted the importance of gaining a deeper understanding of infectious disease spillover. Current evidence suggests that interannual and interdecadal climate variability have a direct influence on the vector-borne diseases. This evidence has been assessed at the continental level in order to determine the possible consequences of the expected future climate change. By 2100, it is estimated that average global temperatures will have risen by 1 to 3.5 degrees Celsius, increasing the likelihood of many vector-borne diseases in new areas. The greatest effect of climate change on transmission is likely to be observed at the extremes of the range of temperatures at which transmission occurs. For many diseases, these lie in the range 14 to 18 degrees Celsius at the lower end and about 35 to 40 degrees Celsius at the upper end. Malaria and dengue fever are among the most important vector-borne diseases in the tropics and subtropics. And Lyme disease is the most common vector-borne disease in the USA and Europe. Growing encephalitis cases is also becoming a public health concern. Remember, health risks due to climatic changes will differ between countries that have developed health infrastructures and those that do not. Human settlement patterns in the different regions will influence disease trends. While 70% of the population in South America is urbanized, the proportion in sub-Saharan Africa is less than 45%. Recent climatic anomalies associated with the El Nino southern oscillation phenomenon. As a result, we can anticipate more frequent and severe droughts and floods. They have been linked to outbreaks of malaria in Africa, Asia and South America. Climate change has far-reaching consequences and touches on all life support systems. It is therefore a factor that should be placed high among those that affect human health and survival. Climate change will have short and long-term impacts on disease transmission. The tropical African climate is favorable to most major vector-borne diseases, including malaria, schistosomiasis, onchocerciasis, trypanosomiasis, filariasis, leishmaniasis, plague, Rift Valley fever, yellow fever and tick-borne hemorrhagic fevers. The continent has a high diversity of vector species complexes that have the potential to redistribute themselves to new climate-driven habitats, leading to new disease patterns. For example, a short-term increase in temperature and rainfall, as was seen in the 1997-98 El Nino, an example of interannual climate variability, caused Plasmodium falciparum malaria epidemics and Rift Valley fever in Kenya. This may have been due to accelerated parasite development and an explosion of vector populations. However, these same changes reduced malaria transmission in the United Republic of Tanzania. Surprising dengue and dengue hemorrhagic fever on the rise in the Americas. Puerto Rico averages 10,000 dengue fever cases annually, and the condition now occurs in nearly all Caribbean countries, and leptospirosis, carried by rodents, has been associated with flooding in Central America. Lyme disease and encephalitis will increasingly become public health threats in the USA, as suitable conditions for transmission increase. However, as understanding of the links between climate and these diseases increases, and climate predictions become better, methods of preventing outbreaks, e.g. through public health information, will improve. Although Lyme disease is treatable, it remains difficult to diagnose. From southwest of the USA, pulmonary hantavirus epidemic was believed to be due to an upsurge in rodent populations related to climate and ecological conditions. Clusters of the disease have been spatially linked to areas with higher rainfall and vegetation following El Nino events. What about its impact on Asia tropical and temperate regions? As of now, dengue fever, dengue hemorrhagic fever, schistosomiasis, and Plasmodium falciparum malaria are endemic in parts of tropical Asia. In the past 100 years, mean surface temperatures have increased by 0.3 to 0.8 degrees Celsius across the continent, and are projected to rise by 0.4 to 4.5 degrees Celsius by 2070. In Australia, the major vector-borne diseases are caused by the Arthritis Ross River and Barma forest viruses, as well as the encephalitic Murray Valley virus. Transmission of these viruses is associated with the availability of mosquito breeding sites and suitable environmental conditions. Flooding has been associated with viral outbreaks. Climate scenarios for Australia for 2030 indicate that temperatures will rise by 0.3 to 1.4 degrees Celsius, with an overall tendency for rainfall to decrease. In New Zealand, there have been concerns that the changing environmental conditions, such as global warming, with concomitant effects on vector distribution, increasingly rapid air travel by viremic persons, and the accidental introduction of new vector mosquitoes, particularly Aedes albopictus. In Asia, dengue fever and malaria have been associated with positive temperature and rainfall anomalies, while in Australia arboviral disease outbreaks are most frequently associated with flooding. Urban developments in Asia and the surrounding regions may have a substantial impact on trends in the transmission of dengue fever. In some areas, such as Vietnam, effects of past civil instability and slow economic growth may also be implicated. The COVID-19 pandemic dramatically changed lives worldwide, leaving lasting physical, emotional, and financial scars that likely to persist lifelong for many. Although the COVID-19 outbreak's immense and unparalleled magnitude might give the impression of a once-in-a-lifetime event, numerous experts argue that it was merely a sign of what lies ahead. Now, in a rather concerning discovery, a recent study has provided additional evidence, highlighting the potential for specific diseases that transfer from animals to humans. Diseases could become exponentially deadlier in the coming decades. Their research suggests that these zoonotic pandemics could claim 12 times more lives in 2050 than they did in 2020. A staggering prediction that demands urgent action to safeguard global public health. The study mentions that outbreaks triggered by diseases that jump from animals to humans, often called spillovers, may become increasingly frequent in the future. This grim prospect is attributed to two critical factors: climate change and deforestation. As our planet grapples with the consequences of human-induced environmental changes, the risk of these diseases crossing from animals to humans looms large. To chart future trends, the study looked at the past of 4 viral pathogens. These included filoviruses such as Ebola and Marburg, SARS coronavirus, Nipah virus, and the Machupo virus. The team found that from 1963 to 2019, 3,150 outbreaks had claimed a staggering numbers of lives. Filoviruses alone caused 15,771 casualties, predominantly in Africa. Perhaps the most alarming revelation was the consistent upward trajectory observed by the researchers. Between 1963 and 2019, epidemics triggered by zoonotic diseases increased by a deadly 5% each year, with fatalities rising by a massive 9%. If these annual rates of increase continue, we would expect the analyzed pathogens to cause 4 times the number of spillover events and 12 times the number of deaths in 2050 than in 2020. These numbers are likely conservative too, considering that COVID-19 was excluded from the analysis. The deadly recent epidemics and pandemics are no accidents. Zoonotic spillovers are getting worse, growing in how bad they get and how far they spread. Growing in how bad they get and how far they spread. Unless we address the root causes of these evils, such as the looming climate crisis and healthcare gaps, and improve cooperation to address the inevitable future pandemics, more deadly pandemics will keep affecting humanity, placing an even heavier burden on marginalized communities. It is crucial for world leaders and healthcare experts to acknowledge the close relationship between the climate crisis and biodiversity loss. Both of these challenges represent significant threats to human health. There is a pressing need for them to call on the World Health Organization, WHO, to formally declare a global health emergency. Further, rapid changes in land use and climbing temperatures are breeding the perfect conditions for more pathogens to make the deadly jump to humans, leading to worrisome new diseases and pandemics. Many studies have shown that access to green spaces is crucial for healthier communities as they help filter air pollution, reduce temperatures. Despite official goals to conserve 30% of the world's land, coastal areas and oceans by 2030, many ecosystems are at the brink of their breaking points. Tipping over could lead to catastrophic harm to health, even if global warming is kept below a 1.5 degrees Celsius increase over pre-industrial levels. Therefore, it is imperative that national climate plans be integrated with biodiversity goals. Health professionals, who command a ton of influence and trust in the public domain, have been urged to advocate for both restoring biodiversity and addressing climate change. Political leaders have also been called upon to recognize the severe threats to health from this planetary crisis and the health benefits that can arise from taking action. Furthermore, it is possible that human populations may adapt to climate change, thus minimizing the impacts. Adaptation to climate change and variability will depend to a certain extent on the level of health infrastructure in the affected regions. Moreover, the cost and efficacy of prevention and cure will be critical to disease management. Furthermore, climate variability, unlike any other epidemiological factor, has the potential to precipitate simultaneously multiple disease epidemics and other types of disasters. Climate change has far-reaching consequences that go beyond health and touch on all life support systems. It is therefore a factor that should be rated high among those that affect human health and survival.
Thanks for watching.